Okay, uh, welcome to our lightning talk today for UC's first ever Healthcare Workforce Diversity Symposium. I will pass the mic over to the speaker to introduce himself.
Hello, everyone. My name is Ryan Marable. I come to you from the great American city of Dayton, Ohio. I've been a resident of Cincinnati since 2005. I came to Cincinnati to pursue my education at the UC College of Pharmacy. I graduated in 2013 with my doctorate in pharmacy. And it's just been a really, really great ride. I'm excited to be here to be a part of this process of the Workforce Diversity Symposium, and just excited to get this going.
Great, thanks so much. So let's just start by maybe having you tell us about why you decided to go into pharmacy.
Yeah, so that's a really great question. So one of the main reasons why I, decided, why pharmacy. Now, growing up in Dayton, one thing that stood out in my lifetime and, things that I would see were I would see just people not necessarily in the best position for care. Low access to care, difficulty receiving, primary care visits and seeing doctors and things of that nature. I just like there was room for practitioners to really step up and be a part of that process versus just trying to, wait for it to come to you, but necessarily, stepping up to the plate and really trying to position oneself to be a part of that process. So in 2004, I had the fortune to be a part of my first internship project. I got to shadow a pharmacist. He was a Black pharmacist. He and his father actually owned the pharmacy, and they had sold it to Walgreens. So they were now positioned as managers within this Walgreens pharmacy, father and son team. And that day, just spending it with them and seeing their process, seeing the relationships that they were able to generate with their patients, seeing how they interacted with doctors through phone calls and creating different health-related interventions, providing vaccinations for patients, answering counseling questions regarding a person's medication profile, and really just being a part of their overall care. I just thought that that was just such an amazing position to be in. I felt like that position had purpose, and it was able to keep them passionate about everything that they did. And just to see that it was a father and son partnership along with that, I just felt like that was something that I could position myself as. So seeing them as role models and as representation for me, I thought that that was something that I wanted to be a part of. And at that moment, back in 2005, I really committed myself to do that. For me, I feel like it was somewhat of a long shot because they were the only individuals that I saw in that space, providing care and advocating for underserved populations in the greater Dayton area, which is still significantly affected as far as having lower access to care and various different health disparities. I just thought that that was such a great thing, and through my commitment for that, and then working along with individuals throughout my undergraduate and graduate program at the University of Cincinnati, it was something that really drove me there. And I'm still committed and still on fire about the profession to this day.
I love it. I love your passion. You can feel it in your words. So thank you for that. So tell us what a typical day is like for you as a pharmacist now.
So, like I mentioned before, is as a pharmacist, I would say, just in short, we're in a business of creating relationships with people. So when you think of a pharmacist, one thing you would think about, okay, we count pills, we provide medical knowledge and expert material. If you're hospitalized, the pharmacist might be responsible for uh, packaging and creating injectables to deliver directly to one's room in order for you to receive that immediate treatment for an acute situation. But just in summary, like one thing that pharmacists have in common, because we're in many different practice settings, including managed care, primary care offices, got your traditional pharmacists in like a community or retail space, you have pharmacists that work in the government agencies like the Drug Enforcement Agency, Food and Drug Administration. One thing that we have most in common is that we create those true relationships with people in order to gain information from them to tell us what their problems are. And our responsibility is to try to make a complex situation, unravel it as much as possible by gaining as much information, and then trying to simplify it in order to be able to deliver that care in an expedient manner for that patient. So just in short, the typical day for me is just fielding information from either patients, doctors' offices, nurse practitioners, dentist offices, working with my team to create as efficient solutions as possible in order for the patient to receive the right care at the right time for the best cost as well. As a retail pharmacist, we often think of cost and increasing access in order to deliver the most positive outcome as possible. So relationship building is probably the quickest way to summarize like what it is I do. I build relationships and I solve problems.
That's really interesting. And I think it's great because it sort of busts that myth that people have of the old school pharmacist who doesn't have a lot of patient interaction, and how that's
Mhm.
really shifted over time, for you to have much more patient interaction. And so students who might want that patient interaction and think medicine is the only route, there's more options for that in pharmacy nowadays.
Absolutely. As the pharmacist, we are the medication expert, but at the same time, we have to make it relatable for our patients. So we have to take that complex information and try to simplify it in a way for a person to be able to internalize it and take that information home and actually utilize it. So whether it's in a hospital setting and they're being discharged, or if they're on the outpatient side, like a retail pharmacy, when they come and see me, at the end of the day, we can't be there with them at home to make sure that they're either taking their medication or following, positive lifestyle habits. We have to make sure that we're educating them, and it doesn't happen unless you can really create that rapport or that pharmacist-patient relationship, and be able to communicate that so they can remember it and actually utilize it for their betterment.
Great, thank you. So, what are some challenges that you face or the field of pharmacy faces?
One of the, I would say, biggest challenges is access and cost. I mean, just being able to have access to the medications. Oftentimes, one of the biggest thing that's being exposed during the coronavirus pandemic is that we often have drug shortages. So if you have a drug shortage, it could be for various reasons. Oftentimes, the manufacturers may not even have to supply the information as to why a drug is in short supply. And with that being said, a patient may receive a prescription from a prescriber. They expect to have that prescription filled and immediately provide it to them, but that's not always the case. So if that person doesn't have access to that medication, that puts their health in jeopardy. Then, conversely, you have situations where they may have access to that medication, but the cost might be a challenge. So there's a lack of transparency as it relates to cost, and oftentimes patients are on the bad end of that situation. So as a pharmacist, we really just try to clear things up on the transparency side, working with manufacturers, working with distributors to make sure that we can have higher access to those medications. And then when we do have access to the medications for the patient's benefit, we want to make sure that we can get those at the best cost. So whether that's working with insurance companies to make sure that the prescriptions are being covered and the treatments are being covered, and that the patients can actually have access to those at a reasonable cost. Because if the patient can't afford it, then they will not take it. Because at the end of the day, they have to make sure that they're taking care of themselves and their families, and if they can't afford it, then they won't take it.
Thanks. So let's talk a little bit about diversity in pharmacy. This is more of a personal question about, do you identify as underrepresented, which I think you sort of spoke to that in the beginning, but if so, how has that really affected your experience in pursuit of this field and then now currently as a pharmacist?
Yeah, so I would say when I first started as a pharmacist, I somewhat took it personal because pharmacists only represent about 7% of the black pharmacists only make up about 7% of the pharmacy workforce. And then when you think about other healthcare professionals, it could be even less than that. When you think of black cardiologists, they only represent about 2% of the population. So taking it personal, you say, you walk into a room full of pharmacists and you look around, there might be 1,000 pharmacists there, and only about 70 to 100 of those pharmacists might be individuals who either look like me or come from backgrounds similar to mine. So taking it personal would be very selfish, but I often try to encourage other health practitioners from minority backgrounds as well as from majority backgrounds to think about the patient. So think of someone who might be walking into a healthcare clinic or into a hospital situation. They might be having a procedure, and you have practitioners who don't come from diverse backgrounds. They may be in a position where they may not understand, or they may not to fully engage with that patient because they've never really had an opportunity to interact with other professionals or other patients on a realistic basis, where they can be able to, I would say, read between the lines and understand what that patient is trying to say, ultimately leading to disparities. So you may have a situation where inadequate treatment is the end result. You may see a misdiagnosis. You may see, potential harm to the patient. So at the end of the day, I'm a strong advocate for diversifying the healthcare workforce, not just pharmacy, but just across the board. Because at the end of the day, it helps to train and develop other practitioners in order for them to deliver the highest quality of care for those patients, because you want your workforce to somewhat mirror the patient population that you're treating. So if you have a diverse patient population, it will be in the best interest of the organization or the healthcare organization to be just as diverse as that population.
Great. Yeah, you really captured why it's important to diversify the healthcare workforce too. So the last question for you, and then Josh Norrie, our intern, is here, and he may have a question for you before we wrap up, is if you did have one piece of advice for an undergraduate pre-health student, what would that one piece of advice be, that golden nugget?
The golden nugget is very simple. It's 3 letters. UBU. And that's a short 3-letter acronym. So UBU stands for you be yourself. So you can't imitate other individuals. You may see some certain things. You may, take certain pieces of skills, qualities, but you can be the best self that you are. No one can be who you are. Understand like what the skills, qualities that you bring to the table, and just try to maximize those to the best of your ability. If you are interacting with certain career opportunities or employers or jobs that might be potentially hiring, if you're mimicking something else or something that you feel that they want, you're leaving behind all of the positive qualities that you have. So one thing I always encourage students to do is really embrace and understand who they are internally, and really try to amplify that, because that employer or that organization might be looking for that person who you are. And if you are who you are and you're the best person you can be, sky's the limit. So you be you, in short.
Love it. Josh, we'll leave you with the last question if you have one. I think you're on mute, so you have to unmute yourself. But do you have a question?
Yeah, you talked a lot about working with a team, and I was wondering, how could you, what are some tips for working with someone or some people who don't really understand, your views about whether it be political or about diversifying the workforce?
Yeah, that's a great question, Josh. So just working with diverse teams, as an coming in as an underrepresented minority into a industry or a work environment in which you might be a minority partner or coming from that underrepresented population, it's just important to try to find some type of common ground before just tackling those difficult or tough issues. Developing that understanding or that common ground really can try to break down some of those barriers that individuals just naturally have. It's called unconscious bias or confirmational bias. You might be looking for something unconsciously in a certain individual, and then if you see it, then it's like, oh, I knew that was the case. But just being able to develop that common ground, or find that commonality between individuals amongst the team, it can help an individual just to be able to elaborate or find out as much information about another culture or another individual as possible. And then at the end of the day, it ultimately helps to strengthen the team. If you have lesser weak links, it really tightens the bonds amongst that team. And at the end of the day, it really can push for or drive for optimal patient care. So just finding that commonality amongst individuals and breaking down those unconscious bias that we all just naturally have. Everyone has them. It really can help to bring teams together.
Thank you.
Thank you so much for your time. This was incredibly helpful. And we just appreciate all you do for UC students in the university, outside the College of Pharmacy too. This is going to help a lot of people beyond your reach in the College of Pharmacy. So I'm going to stop the recording now. Thanks again.
All right. Thank you guys. Go Bearcats.